Clinical nutrition and dosage math can look intimidating on an exam, but we are not dealing with complex calculus. Mastering variables like TPN, drop rates, and BMI is a matter of following a specific sequence where each value feeds the next calculation. Look at this split-screen reference board. The left side holds the absolute, non-negotiable first rule of clinical math: convert pounds to kilograms. You do this by dividing the patient's weight in pounds by 2.2. Examiners set traps by offering answers based on the initial pound weight. If you skip this division, every subsequent calculation is wrong. On the right side, the board displays our strict volume rules: 30 milliliters per ounce, 5 per teaspoon, and 15 per tablespoon. These exact conversions are what you will use to calculate patient intake and output totals, as well as precise tube feeding volumes. Memorizing these starting parameters builds a defense mechanism. When a complex question throws irrelevant numbers at you, applying these weight and volume rules isolates exactly what you need to proceed. This flowchart maps out how a single physical measurement branches into 3 distinct clinical metrics. Every patient-specific calculation begins with their body weight. A 200-pound patient flows down to our central hub, filtering into 90.9 kilograms before any further math happens. Following the left branch leads us to body mass index. You take that kilogram weight and divide it by the patient's height in meters squared. The exam triggers here are rigid. A result of 25 or higher flags the patient for overweight risks, and 30 or higher categorizes them with obesity. The center branch calculates daily calories. For a healthy adult, maintenance requires multiplying their kilogram weight by 25 to 30 calories. If the clinical goal is weight loss, you apply a strict 500-calorie daily deficit, which equals 1 pound of fat lost per week. The right branch determines protein requirements. A normal adult needs 0.8 grams per kilogram. However, under the metabolic stress of illness or injury, that rate increases to between 1.2 and 2 grams per kilogram to support tissue repair. These metabolic formulas are only accurate if they are applied to a patient's weight in kilograms. The conversion must happen first. Moving from bodily metrics to external inputs, this grid breaks down macronutrient math. Carbohydrates and proteins both provide 4 calories per gram, fat provides 9, and alcohol provides 7. Examiners test this arithmetic by asking you to multiply a value like 10 grams of fat by its 9-calorie factor to find the 90 total calories. This universal formula simplifies tube feeds and total parenteral nutrition. While the terms are clinical, the math is straightforward division. Take the total ordered volume and divide it by the total hours. A 2,000 milliliter TPN bag ordered over 24 hours equals an output of 83 milliliters per hour. The final stage of this process translates that hourly rate into an exact IV drip rate. Multiply the milliliters per hour by the tubing's drop factor, then divide by 60 minutes. Running 125 milliliters an hour through standard 15-drop tubing divides out to 31 drops per minute. Let's apply both steps. Pause the video and find the drops per minute for a 1,200 milliliter feed ordered over 24 hours using a drop factor of 15. First, divide volume by time to get 50 milliliters an hour. Next, multiply 50 by the 15 drop factor and divide by 60 to reach 12.5, which rounds up to 13 drops per minute. If your exam question specifies microdrip tubing, you can bypass the full formula. Because microdrip tubing is calibrated to 60 drops per milliliter, your hourly volume rate will always match your drops per minute. Clinical math operates on strict logic. You are never solving one massive problem. You are executing a sequence of simple division steps, where each answer provides the input for the next part of the equation. Let's lock down the visual triggers that dictate your exam strategy. When given weight in pounds, immediately convert to kilograms. See a drop factor? Solve for drops per minute. Given volume and time, divide them. If calculated BMI reaches 30, classify as obesity. This dashboard is your structural cheat sheet. Moving through these formulas in order isolates the required variables, ensuring calculation accuracy. Passing clinical math requires trusting this sequential blueprint. Apply these rules to every patient, and the correct answer becomes clear.